Question 1. Process analysis reveals that a registered yoga teacher, RYT, with a therapeutic focus is leading a group class when a student privately informs them of a recent significant knee injury requiring specific modifications for poses involving knee flexion or weight bearing. Which of the following actions best exemplifies creating an inclusive and therapeutically appropriate environment for this student and the class? Option A. Ask the student to perform a separate, less strenuous sequence of movements in a corner of the room to avoid disrupting the main class. Option B. Proceed with the class as planned, assuming the student will naturally modify their own practice based on their injury. Option C. Discreetly communicate with the student before class begins to understand their specific limitations and collaboratively plan modifications that can be integrated into the general class flow, ensuring their safety and participation. Option D. Announce to the entire class that modifications will be made for knee injuries, and then implement a series of generalized knee-friendly poses for everyone, regardless of individual need. The correct answer is C. Discreetly communicate with the student before class begins to understand their specific limitations and collaboratively plan modifications that can be integrated into the general class flow, ensuring their safety and participation. Explanation. Scenario analysis. A registered yoga teacher, RYT, with a therapeutic focus faces the challenge of creating an inclusive environment when a student discloses a recent significant injury requiring specific modifications. This scenario is professionally challenging because the RYT must balance the student's immediate therapeutic needs with the broader goal of creating a safe and welcoming space for all participants, while adhering to professional standards of practice and ethical considerations. The RYT's judgment is critical in ensuring the student receives appropriate support without compromising the experience or safety of others. Correct approach analysis. The correct approach involves proactively communicating with the student to understand their specific limitations and needs, and then thoughtfully integrating necessary modifications into the class flow. This represents best professional practice because it directly addresses the student's therapeutic requirements in a sensitive and informed manner. It aligns with the ethical principles of non-maleficence, do no harm, and beneficence, act in the best interest of the student, as well as the RYT's responsibility to provide instruction that is safe and appropriate for all levels and conditions. By offering modifications, the RYT demonstrates a commitment to inclusivity, ensuring the injured student can participate meaningfully and safely, thereby fostering a supportive and therapeutic environment. This proactive and individualized approach is a hallmark of therapeutic yoga practice. Incorrect approaches analysis. One incorrect approach involves proceeding with the class as planned without acknowledging the student's disclosure, assuming they will self-modify. This is professionally unacceptable as it disregards the student's stated needs and the RYT's duty of care. It represents an ethical failure to be attentive and responsive to individual student circumstances, potentially leading to further injury and violating the principle of non-maleficence. Another incorrect approach is to isolate the student by asking them to perform entirely different exercises away from the group, or to sit out the entire class. While well-intentioned, this can inadvertently stigmatize the student, making them feel excluded rather than included. Ethically, this fails to foster a sense of community and belonging, which is a core aspect of a therapeutic yoga environment. It also may not be therapeutically beneficial if the student is capable of participating with modifications. A third incorrect approach is to make broad, generalized modifications for the entire class that may not be suitable for the injured student or could unnecessarily limit the practice for others. This lacks the individualized attention required for therapeutic focus and inclusivity. It fails to demonstrate the RYT's ability to adapt instruction to specific needs, potentially leading to a less effective or even unsafe practice for various students. Professional reasoning. Professionals should employ a decision-making process that prioritizes student safety and well-being, followed by ethical considerations and professional competence. This involves active listening, clear communication, and a thorough understanding of anatomy and modifications relevant to therapeutic yoga. When faced with a student's disclosure of injury, the RYT should first assess the situation, then communicate directly and privately with the student to gather information, and finally, integrate appropriate modifications seamlessly into the class, ensuring all students feel seen, supported, and safe. This process emphasizes a student-centered, ethical, and competent approach to teaching. Question 2. The audit findings indicate a need to review the registered yoga teachers (RYT) approach to addressing knee discomfort in clients. Specifically, the audit highlighted a lack of detailed consideration for the reciprocal relationship between opposing muscle groups that contribute to knee stability. A client presents with mild anterior knee pain during flexion, and the RYT is developing a therapeutic yoga plan. Which of the following approaches best reflects a competent and ethically sound application of anatomical knowledge regarding muscle groups and their functions in this scenario? Option A. Conduct a thorough assessment of the client's knee movement and pain, and then design a plan that addresses the functional interplay between the quadriceps and hamstrings, considering their roles in knee extension and flexion stability, and recommending appropriate modifications or poses. Option B. Focus on strengthening the quadriceps to provide better support for the knee, without specific consideration for the hamstrings. Option C. Prescribe a regimen of deep stretching for the hamstrings to release any perceived tightness that might be contributing to the knee pain. Option D. Recommend a series of poses that primarily target hip flexors and gluteal muscles, assuming this will indirectly alleviate knee discomfort. The correct answer is B. Focus on strengthening the quadriceps to provide better support for the knee, without specific consideration for the hamstrings. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the registered yoga teacher (RYT) to interpret and apply knowledge of anatomy and physiology within the context of therapeutic yoga, while also adhering to professional standards and ethical considerations. The audit findings suggest a potential gap in the teacher's understanding or application of muscle group functions, which could impact client safety and the efficacy of therapeutic interventions. The challenge lies in accurately assessing the client's needs and recommending appropriate modifications or poses that address specific muscle imbalances or dysfunctions without overstepping the scope of practice for an RYT. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a thorough understanding of the client's specific condition and the role of relevant muscle groups. It involves a collaborative approach with the client, seeking to understand their experience and limitations. Crucially, it emphasizes the RYT's role in providing yoga-based guidance and recognizing when to refer to other healthcare professionals. This aligns with the ethical guidelines of the yoga profession, which stress competence, client well-being, and the importance of working within one's scope of practice. By focusing on the quadriceps and hamstrings and their reciprocal relationship in knee stability, the teacher is demonstrating a targeted and informed application of anatomical knowledge to a common therapeutic concern. This approach is grounded in the understanding that therapeutic yoga aims to support, not replace, medical treatment. Incorrect approaches analysis. One incorrect approach involves making broad assumptions about the client's condition and prescribing a generic set of poses without a detailed assessment of the specific muscle groups involved and their functional deficits. This fails to meet the ethical obligation of providing individualized care and could lead to ineffective or even harmful recommendations. It also risks overstepping the RYT's scope of practice by implying a diagnostic or prescriptive capability beyond yoga instruction. Another incorrect approach is to focus solely on strengthening one muscle group, e.g., quadriceps, without considering the opposing muscle group, e.g., hamstrings, and their functional interplay. This demonstrates a superficial understanding of biomechanics and muscle function, potentially leading to an imbalanced approach that could exacerbate existing issues or create new ones. It neglects the principle of holistic and balanced movement that is fundamental to therapeutic yoga. A third incorrect approach is to recommend advanced or complex poses that are not appropriate for a client with potential knee instability, without proper assessment or modification. This prioritizes a desire to teach advanced techniques over client safety and well-being, a clear ethical failure. It also indicates a lack of understanding of how different muscle groups contribute to the stability and execution of various poses. Professional reasoning. Professionals should adopt a systematic approach that begins with a comprehensive client assessment, including understanding their reported issues and limitations. This should be followed by applying anatomical and physiological knowledge to identify relevant muscle groups and their functions in relation to the client's concerns. The decision-making process should always prioritize client safety, followed by efficacy of the yoga intervention and adherence to professional scope of practice. When in doubt, or when the condition extends beyond the RYT's expertise. Seeking consultation with or referring to appropriate healthcare professionals is paramount. This ensures a client-centered, ethical, and effective therapeutic yoga practice. Question 3. The evaluation methodology shows that when assessing the impact of breath on a client presenting with symptoms of anxiety and fatigue, what is the most appropriate therapeutic approach for a registered yoga teacher RYT with a therapeutic focus? Option A. Focus exclusively on diaphragmatic breathing to improve lung capacity, without considering the client's emotional state or potential contraindications for their specific symptoms. Option B. Recommend advanced breath retention techniques to help the client gain a sense of control over their physiological responses, as this is often a key component of managing anxiety. Option C. Prescribe specific pranayama exercises known to increase energy levels, assuming that increased physical vitality will directly alleviate anxiety and fatigue. Option D. Integrate breathwork techniques that promote parasympathetic nervous system activation, alongside mindful movement and relaxation, while maintaining awareness of the client's overall well-being and referring to appropriate healthcare professionals for medical or psychological treatment. The correct answer is D. Integrate breathwork techniques that promote parasympathetic nervous system activation, alongside mindful movement and relaxation, while maintaining awareness of the client's overall well-being and referring to appropriate healthcare professionals for medical or psychological treatment. Explanation. This scenario presents a professional challenge for a registered yoga teacher RYT with a therapeutic focus because it requires discerning the most appropriate and evidence-informed approach to addressing a client's specific health concerns through breathwork, while adhering to the ethical and regulatory boundaries of their practice. The challenge lies in moving beyond general breathwork benefits to a targeted, therapeutic application that respects the scope of practice for an RYT and avoids overstepping into medical diagnosis or treatment. Careful judgment is required to ensure the recommendations are safe, effective, and aligned with established guidelines for therapeutic yoga. The correct approach represents best professional practice because it prioritizes a holistic assessment of the client's physical and mental health, integrating this understanding with the principles of breathwork. This approach acknowledges the interconnectedness of breath, body, and mind, and seeks to apply breath techniques in a manner that is tailored to the individual's needs and limitations. It aligns with the therapeutic focus of an RYT by emphasizing a client-centered, evidence-informed strategy that respects the scope of practice, which includes supporting well-being and facilitating self-regulation, but not diagnosing or treating medical conditions. This approach is ethically sound, as it promotes client safety and well-being through informed and appropriate guidance. An incorrect approach that focuses solely on the physiological benefits of breathwork, without considering the client's specific mental health presentation, is professionally unacceptable. This failure stems from a lack of comprehensive assessment and an oversimplification of the therapeutic relationship. Risks recommending techniques that may be ineffective or even counterproductive for the client's particular mental health challenges, thereby violating the ethical duty of care. Furthermore, it may implicitly suggest a level of expertise in mental health treatment that an RYT does not possess, potentially leading to harm and a breach of professional boundaries. Another incorrect approach that involves recommending specific breathwork techniques as a direct treatment for a diagnosed mental health condition is a significant regulatory and ethical failure. This constitutes practicing outside the scope of an RYT's certification and expertise, encroaching upon the domain of licensed mental health professionals. It is a direct violation of ethical guidelines that prohibit providing medical or psychological treatment without appropriate licensure and training. Such an approach can lead to a delay in the client seeking appropriate professional medical or psychological care, potentially exacerbating their condition. The professional reasoning process for similar situations should involve a thorough client intake that includes understanding their health history, current physical and mental health status, and their goals for yoga practice. This should be followed by a careful consideration of how breathwork, within the scope of an RYT's practice, can support their well-being. Professionals must continuously educate themselves on the latest research regarding breathwork and its impact on physical and mental health, always prioritizing client safety and ethical conduct. When a client presents with complex physical or mental health conditions, consultation with or referral to appropriate healthcare professionals is paramount. Question 4. Investigation of how a registered yoga teacher RYT with a therapeutic focus should prioritize their understanding of the human musculoskeletal system when designing a class for individuals experiencing mild joint discomfort, considering the following aspects: the functional anatomy of major weight-bearing joints, the biomechanics of common yoga postures, and the potential for yoga to influence joint health. Option A, emphasizing the study of specific orthopedic conditions and their surgical interventions to provide detailed advice on joint rehabilitation. Option B, concentrating on the historical evolution of yoga postures without considering their direct impact on joint mechanics or individual anatomical variations. Option C, focusing primarily on the philosophical and spiritual aspects of yoga, assuming that a general sense of well-being will address physical discomfort. Option D, prioritizing a deep understanding of the functional anatomy of major weight-bearing joints, e.g., hips, knees, shoulders, and the biomechanics of common yoga postures to inform safe modifications and pose sequencing. The correct answer is D, prioritizing a deep understanding of the functional anatomy of major weight-bearing joints, e.g., hips, knees, shoulders, and the biomechanics of common yoga postures to inform safe modifications and pose sequencing. Explanation: this scenario presents a professional challenge for a registered yoga teacher RYT with a therapeutic focus due to the inherent responsibility of guiding individuals with potential musculoskeletal conditions. The challenge lies in accurately assessing the relevance of anatomical knowledge to a student's specific needs and ensuring that yoga practices are safe and beneficial without overstepping the scope of practice. Careful judgment is required to balance providing supportive guidance with recognizing the limitations of a yoga teacher's role, especially when dealing with the complexities of major bones and joints. The correct approach represents best professional practice because it prioritizes a foundational understanding of anatomy relevant to yoga practice. This aligns with the ethical and professional standards expected of an RYT with a therapeutic focus, which implicitly requires a working knowledge of the body's structure to adapt poses and offer modifications safely. By focusing on the major bones and joints involved in common yoga postures, the teacher can more effectively identify potential contraindications or areas requiring special attention, thereby enhancing student safety and therapeutic outcomes. This approach supports the RYT's role in facilitating a safe and effective yoga experience, which is a core tenet of therapeutic yoga. An incorrect approach that focuses solely on the philosophical underpinnings of yoga without acknowledging the physical body structure fails to meet the therapeutic aspect of the RYT designation. This is an ethical failure, as it neglects the safety and well-being of students who are engaging in physical postures. Another incorrect approach that delves into advanced medical diagnosis and treatment of joint pathologies is a regulatory and ethical failure, because it exceeds the scope of practice for a yoga teacher. Yoga teachers are not licensed medical professionals and should not attempt to diagnose or treat medical conditions. This could lead to harm if incorrect advice is given or if a student delays seeking appropriate medical care. The professional decision-making process for similar situations should involve a tiered approach. First, identify the core competencies required for the RYT designation with a therapeutic focus, which includes a strong understanding of anatomy and biomechanics relevant to yoga. Second, assess the student's stated needs and any disclosed limitation, always encouraging them to consult with healthcare professionals for diagnosis and treatment. Third, apply anatomical knowledge to modify poses and offer safe alternatives, always within the scope of yoga instruction. Finally, maintain a clear boundary between yoga instruction and medical advice, referring students to qualified healthcare providers when necessary. Question 5. What factors determine the ethical and therapeutic boundaries for a registered yoga teacher RYT with a therapeutic focus when a client presents with significant emotional distress alongside physical symptoms, drawing from yoga philosophy? Option A. The RYT's desire to provide a comprehensive wellness experience, even if it means offering advice and interventions that fall outside their formal training and professional scope. Option B. The RYT's personal belief system regarding the all-encompassing power of yoga to heal all ailments, regardless of their training or the client's specific condition. Option C. The RYT's interpretation of the client's emotional state based on superficial observations, without considering the client's history or the potential need for specialized mental health support. Option D. The RYT's understanding of yoga philosophy, including principles like ahimsa and svadharma, their defined scope of practice, and the necessity of referring clients to other healthcare professionals when their needs exceed the RYT's expertise. The correct answer is D. The RYT's understanding of yoga philosophy, including principles like ahimsa and svadharma, their defined scope of practice, and the necessity of referring clients to other healthcare professionals when their needs exceed the RYT's expertise. Explanation. Scenario analysis. A registered yoga teacher, RYT, with a therapeutic focus faces a client experiencing significant emotional distress alongside physical discomfort. The challenge lies in discerning the appropriate boundaries of yoga practice in a therapeutic context, ensuring client safety, and upholding professional integrity without overstepping into roles for which they are not qualified. This requires a deep understanding of yoga philosophy as it intersects with therapeutic intent, recognizing that while yoga can be a powerful tool for well-being, it is not a substitute for professional mental health care. The RYT must navigate the ethical imperative to do no harm, while leveraging their training to support the client's holistic healing journey. Correct approach analysis. The correct approach prioritizes a client-centered, ethically grounded understanding of yoga philosophy. This involves recognizing that the ethical application of yoga in a therapeutic context necessitates a clear understanding of the teacher's scope of practice. It means drawing upon yogic principles such as ahimsa, non-harming, and satya, truthfulness, to guide interactions, ensuring that the teacher's actions are honest about their capabilities and limitations. Furthermore, it involves integrating the yogic concept of svadharma, one's own duty or nature, to understand their role as a yoga teacher, not a therapist. This approach emphasizes collaboration with other healthcare professionals when necessary, respecting the client's autonomy and well-being above all else. This aligns with the ethical guidelines of professional yoga organizations that advocate for responsible practice and client safety. Incorrect approaches analysis. One incorrect approach involves assuming that advanced yoga training automatically qualifies the RYT to provide mental health counseling. This violates the principle of ahimsa by potentially causing harm through unqualified intervention. It also breaches ethical guidelines by misrepresenting one's professional scope, which is a form of dishonesty, asatya. Another incorrect approach is to solely focus on physical postures, asanas, without acknowledging the client's emotional state, thereby neglecting the holistic principles of yoga philosophy that emphasize the interconnectedness of mind, body, and spirit. This can be detrimental to a client seeking therapeutic support and fails to uphold the RYT's commitment to a therapeutic focus. A third incorrect approach is to dismiss the client's emotional distress as outside the purview of yoga, thereby failing to apply yogic principles of compassion, karuna, and empathy. This can alienate the client and prevent them from benefiting from the supportive aspects of yoga practice, potentially causing emotional harm by invalidating their experience. Professional reasoning. Professionals in therapeutic yoga should employ a decision-making framework that begins with a thorough assessment of the client's needs, considering both physical and emotional aspects. This assessment should be followed by a clear identification of the RYT's scope of practice, informed by their training and the ethical guidelines of their profession. When a client's needs extend beyond the RYT's expertise, the professional decision-making process dictates a referral to appropriate specialists, such as licensed therapists or counselors. Throughout this process, open and honest communication with the client is paramount, ensuring they understand the RYT's role and the limitations of yoga practice in addressing complex mental health issues. This framework ensures that the RYT acts with integrity, prioritizes client safety, and upholds the ethical standards of their profession. Question 6. When evaluating the practical application of yoga's limbs for a client experiencing chronic lower back pain and anxiety, which approach best aligns with the RYT's therapeutic focus and regulatory guidelines for supporting well-being? Option A. Suggesting vigorous and challenging asanas to build physical resilience, without considering the client's specific pain condition or potential contraindications. Option B. Prioritizing gentle, modified asanas to improve core strength and flexibility, incorporating pranayama techniques for nervous system regulation, and guiding mindfulness practices to manage pain perception and anxiety. Option C. Focusing primarily on the philosophical study of the yamas and niyamas to cultivate ethical living, believing that adherence to these principles will indirectly alleviate physical and mental distress. Option D. Recommending advanced pranayama techniques and complex meditation practices to achieve spiritual enlightenment, assuming this will resolve all physical and emotional discomfort. The correct answer is B. Prioritizing gentle, modified asanas to improve core strength and flexibility, incorporating pranayama techniques for nervous system regulation, and guiding mindfulness practices to manage pain perception and anxiety. Explanation. This scenario presents a common challenge in therapeutic yoga settings, balancing the broad philosophical underpinnings of yoga with the specific, evidence-informed needs of individuals experiencing chronic pain. The professional challenge lies in discerning which aspects of yoga's limbs are most directly applicable and safe for therapeutic intervention, while respecting the client's autonomy and the scope of practice for a registered yoga teacher, RYT, with a therapeutic focus. Careful judgment is required to avoid overstepping professional boundaries or recommending practices that could be counterproductive. The correct approach emphasizes the practical, somatic, and mindful aspects of yoga that directly address physical and mental well-being. This aligns with the RYT's therapeutic focus, which necessitates an understanding of how yoga can be adapted to support healing and management of specific conditions. Regulatory frameworks for therapeutic yoga professionals typically encourage the application of evidence-informed practices and a client-centered approach, focusing on pranayama for breath regulation, asana for gentle movement and body awareness, and dhyana for stress reduction, directly supports therapeutic goals without venturing into areas requiring medical diagnosis or treatment. This approach is best professional practice because it is grounded in the principles of therapeutic application, client safety, and the ethical responsibility to provide relevant and beneficial support within the RYT scope. An incorrect approach that solely emphasizes the philosophical or spiritual aspects of yoga without clear therapeutic application can be problematic. While these limbs are integral to yoga's holistic nature, their direct application in a therapeutic context without careful adaptation and consideration of the client's condition may not be effective or appropriate. For instance, focusing exclusively on yamas and niyamas as a primary intervention for chronic pain, without addressing the physical or mental symptoms, could be seen as a failure to provide relevant therapeutic support. This might also be interpreted as a lack of understanding of the therapeutic focus, potentially leading to unmet client needs. Another incorrect approach might involve recommending complex or advanced pranayama techniques without proper assessment of the client's respiratory capacity or mental state, which could pose a safety risk and fall outside the RYT's scope of practice for therapeutic intervention. This would represent a failure to adhere to safety protocols and a potential overreach into areas requiring specialized medical expertise. The professional decision-making process for similar situations should involve a thorough client assessment, including understanding their specific condition, limitations, and goals. The RYT should then draw upon their knowledge of yoga's limbs, prioritizing those with demonstrable therapeutic benefits and adapting them to the individual's needs. This involves a continuous process of observation, feedback, and modification, always within the RYT's scope of practice and in collaboration with the client. Ethical considerations, such as informed consent and maintaining professional boundaries, are paramount. Question 7. System analysis indicates that a client attending a therapeutic yoga session reports feeling tight in the chest and short of breath during gentle movement. The registered yoga teacher, RYT, observes that the client's breathing appears shallow and primarily uses the upper chest. The RYT needs to determine the most appropriate next step in addressing the client's breathing mechanics within their therapeutic yoga practice. Which of the following represents the most professionally responsible and ethically sound approach? Option A. Conduct a detailed assessment of the client's posture, movement patterns, and subjective experience of breathing, then integrate gentle diaphragmatic breathing exercises and modifications into the yoga practice to support improved respiratory function. Option B. Proceed with the planned yoga session, focusing on poses that do not heavily engage the respiratory system, and advise the client to simply breathe deeper when they feel short of breath. Option C. Immediately recommend that the client see a medical doctor for a full respiratory workup, as breathing difficulties are beyond the scope of a yoga teacher. Option D. Introduce advanced pranayama techniques designed to increase lung capacity, assuming the client's current breathing pattern is a result of poor yoga practice. The correct answer is A. Conduct a detailed assessment of the client's posture, movement patterns, and subjective experience of breathing. Then integrate gentle diaphragmatic breathing exercises and modifications into the yoga practice to support improved respiratory function. Explanation. Scenario analysis. This scenario presents a professional challenge for a registered yoga teacher RYT with a therapeutic focus because it involves assessing a client's breathing mechanics, which directly impacts their physical and emotional well-being. Misinterpreting or inadequately addressing breathing patterns can lead to ineffective therapeutic outcomes or, worse, exacerbate existing conditions. The RYT must navigate the delicate balance between providing appropriate guidance based on their training and recognizing the boundaries of their scope of practice, especially when dealing with potential underlying medical issues. Careful judgment is required to ensure client safety and to uphold professional standards. Correct approach analysis. The correct approach involves a comprehensive assessment of the client's breathing mechanics, considering their posture, movement patterns, and subjective experience. This aligns with the RYT's therapeutic focus, which necessitates understanding how the body functions and how yoga practices can influence it. The RYT should observe for signs of shallow breathing, paradoxical breathing, or excessive tension in the respiratory muscles. They should then integrate this understanding into a personalized yoga practice, offering modifications and specific pranayama techniques that are safe and beneficial for the client's current state. This approach is ethically sound as it prioritizes the client's holistic well-being and is grounded in the RYT's specialized training in therapeutic yoga. It adheres to the principle of do no harm by ensuring interventions are appropriate and informed. Incorrect approaches analysis. One incorrect approach involves immediately recommending advanced pranayama techniques without a thorough assessment of the client's current breathing capacity and any potential contraindications. This is ethically problematic because it bypasses the crucial initial assessment phase, potentially overwhelming the client or triggering adverse reactions. It fails to demonstrate due diligence and could be seen as negligent if the client experiences discomfort or negative effects. Another incorrect approach is to dismiss the client's concerns about their breathing as insignificant and proceed with a generic yoga class. This is professionally unacceptable as it disregards the client's subjective experience and the therapeutic aspect of the RYT's role. It demonstrates a lack of empathy and a failure to recognize that breathing mechanics are a fundamental component of therapeutic yoga. This approach neglects the core principles of personalized care and could lead to client dissatisfaction and a loss of trust. A third incorrect approach is to diagnose a specific respiratory condition based on the observed breathing patterns, and then prescribe a course of action that extends beyond the RYT's scope of practice, such as recommending specific medical treatments. This is a significant ethical and potentially legal failure. RYTs are not medical professionals and should not attempt to diagnose or treat medical conditions. Their role is to support well-being through yoga practices within their defined scope. Professional reasoning. Professionals in therapeutic yoga should employ a decision-making process that begins with a thorough client assessment, including observation of breathing mechanics. This assessment should inform the development of a safe and effective yoga practice tailored to the individual's needs and limitations. Professionals must continuously operate within their scope of practice, referring clients to qualified medical practitioners when concerns extend beyond their expertise. Maintaining clear communication with the client about the purpose and limitations of yoga interventions is paramount. Ethical guidelines and professional standards for RYTs emphasize client safety, informed consent, and the importance of a holistic, yet appropriately bounded, approach to therapeutic yoga. Question 8. Strategic planning requires a therapeutic yoga teacher to anticipate potential client requests that may conflict with their established therapeutic goals or pose safety concerns. A client who has been working with the teacher for several weeks on managing chronic lower back pain through gentle poses and mindful movement, expresses a strong desire to incorporate a more advanced inversion pose into their practice during the next session, stating it's something they've always wanted to try. The teacher has assessed the client's current physical capacity and notes that this pose, without significant modification, could potentially aggravate their back condition. What is the most ethically sound and therapeutically appropriate course of action for the teacher? Option A. Politely decline the client's request to try the advanced inversion pose without providing any further explanation or offering alternatives, as the teacher's professional judgment supersedes the client's wishes. Option B. Immediately agree to the client's request to try the advanced inversion pose, as respecting client autonomy and fulfilling their desires is paramount in a therapeutic setting. Option C. Agree to the client's request to try the advanced inversion pose, but instruct them to perform it with caution and to stop if they feel any discomfort, without offering specific modifications or guidance on how to safely attempt it. Option D. Gently explain to the client that, while their enthusiasm is appreciated, the requested pose is not currently recommended due to their specific back condition and the established therapeutic goals. Offer to explore modifications or alternative poses that can safely build towards similar benefits or address their desire for a challenging practice within their current limitations. Correct answer is D. Gently explain to the client that, while their enthusiasm is appreciated, the requested pose is not currently recommended due to their specific back condition and the established therapeutic goals. Offer to explore modifications or alternative poses that can safely build towards similar benefits or address their desire for a challenging practice within their current limitations. Explanation. This scenario presents a common ethical challenge for therapeutic yoga teachers, balancing a client's expressed desires with the teacher's professional judgment regarding safety and efficacy. The challenge lies in discerning when a client's request, while seemingly benign, might inadvertently lead to harm or deviate from the therapeutic goals established in the client's intake and treatment plan. The teacher must navigate the client's autonomy and the teacher's responsibility to provide safe and appropriate guidance. The correct approach represents best professional practice because it prioritizes the client's well-being and adheres to the core ethical principles of non-maleficence, do no harm, and beneficence, act in the client's best interest. By consulting with the client about the potential risks and benefits, and by offering modifications or alternative poses that align with the therapeutic plan, the teacher demonstrates respect for the client's input while upholding their professional duty of care. This approach ensures that the yoga practice remains a therapeutic tool, tailored to the individual's needs and limitations, and avoids compromising the established therapeutic relationship or the client's safety. An incorrect approach that involves immediately accommodating the client's request without further discussion or consideration of modifications fails to uphold the principle of non-maleficence. It risks exacerbating the client's existing condition or introducing new injuries, thereby violating the teacher's responsibility to provide safe instruction. Another incorrect approach, which is to dismiss the client's request outright without explanation or offering alternatives, can be perceived as disrespectful and may damage the therapeutic alliance. This can lead to client dissatisfaction and a breakdown in trust, hindering the therapeutic process. A further incorrect approach, such as agreeing to the request but then failing to provide appropriate guidance or modifications, also constitutes a failure in the duty of care, as it implies endorsement of a potentially unsafe practice without ensuring proper execution. Professionals should employ a decision-making framework that begins with active listening to the client's request. This should be followed by an assessment of the request against the client's known condition, therapeutic goals, and established safety protocols. If the request poses a potential risk or deviates from the therapeutic plan, the professional should engage in open communication with the client, explaining their concerns and offering evidence-based alternatives or modifications. This collaborative approach ensures that the client feels heard and respected while maintaining the integrity of the therapeutic intervention. Question 9. Risk assessment procedures indicate a client presence with moderate anxiety and mild depressive symptoms, reporting they are currently undergoing psychotherapy and are prescribed medication. As a registered yoga teacher with a therapeutic focus, which of the following approaches best aligns with professional best practices and ethical guidelines for supporting this client's well-being through yoga? Option A. Design a yoga practice incorporating gentle somatic movements, mindful breathing exercises known to regulate the nervous system, and guided relaxation techniques, while ensuring open communication with the client about their comfort levels and encouraging them to continue their established therapeutic treatments. Option B. Focus exclusively on vigorous vinyasa flows to release pent-up energy, without inquiring about their current mental health treatment or their physical limitations. Option C. Introduce advanced pranayama techniques and inversions to challenge the client's physical and mental resilience, believing that pushing boundaries will accelerate their recovery from anxiety and depression. Option D. Provide direct recommendations on adjusting their prescribed medication dosages and offer psychological interpretations of their symptoms based on yoga philosophy. The correct answer is A. Design a yoga practice incorporating gentle somatic movements, mindful breathing exercises known to regulate the nervous system, and guided relaxation techniques, while ensuring open communication with the client about their comfort levels and encouraging them to continue their established therapeutic treatments. Explanation: this scenario is professionally challenging because it requires a registered yoga teacher RYT with a therapeutic focus to navigate the delicate balance between providing supportive yoga practices and recognizing the boundaries of their scope of practice when dealing with individuals experiencing anxiety and depression. The RYT must ensure their interventions are evidence-informed, safe, and ethically sound, avoiding any actions that could be construed as practicing psychotherapy without appropriate licensure or qualifications. The correct approach represents best professional practice because it prioritizes client safety and well-being by integrating evidence-based yoga techniques known to support mental health, while simultaneously emphasizing the importance of collaboration with healthcare professionals and respecting the client's existing treatment plan. This aligns with ethical guidelines for allied health professionals which advocate for a holistic, client-centered approach that respects professional boundaries and promotes interdisciplinary care. Specifically, it acknowledges that yoga can be a complementary therapy, not a standalone treatment for complex mental health conditions, and that referrals and communication with other practitioners are crucial for comprehensive care. An incorrect approach that involves solely focusing on advanced pranayama techniques without considering the individual's current mental state or potential contraindications would be an ethical failure. This could lead to exacerbating symptoms or creating an unsafe practice environment, violating the principle of do no harm. Another incorrect approach, such as offering direct advice on medication or diagnosing the severity of the client's condition, constitutes practicing outside the RYT scope of practice and could be a regulatory violation, as it encroaches upon the domain of licensed mental health professionals. Furthermore, an approach that neglects to inquire about or respect the client's existing treatment plan or engage in communication with their healthcare providers would be an ethical lapse, potentially undermining the client's overall care and demonstrating a lack of professional collaboration. The professional decision-making process for similar situations should involve a thorough risk assessment, understanding the client's individual needs and history, and clearly defining the RYT's scope of practice. It requires ongoing professional development in therapeutic yoga, a commitment to ethical practice, and the ability to recognize when to refer to or collaborate with other healthcare professionals. The RYT should always prioritize the client's safety, autonomy, and the integrity of their therapeutic journey. Question 10. The risk matrix shows that a registered yoga teacher RYT with a therapeutic focus is considering how to explain the potential benefits of yoga to students experiencing low mood. Which approach best aligns with the RYT's scope of practice and ethical guidelines regarding neurotransmitters and their effects on mood and behavior? Option A. State that neurotransmitters are too complex to be relevant to yoga practice, and that students should focus solely on the physical aspects of the poses. Option B. Explain that certain yoga practices can promote relaxation and mindfulness, which are known to positively influence the body's natural production of mood-regulating neurotransmitters like serotonin and dopamine, thereby supporting overall emotional well-being. Option C. Offer to assess students for neurotransmitter deficiencies and recommend specific yoga sequences as a primary treatment for any identified imbalances. Option D. Advise students that specific yoga poses are scientifically proven to directly increase serotonin levels, effectively curing feelings of sadness and depression. Correct answer is B. Explain that certain yoga practices can promote relaxation and mindfulness, which are known to positively influence the body's natural production of mood-regulating neurotransmitters like serotonin and dopamine, thereby supporting overall emotional well-being. Explanation. The scenario presents a common challenge for therapeutic yoga teachers, understanding the neurochemical underpinnings of mood and behavior to effectively guide students. The professional challenge lies in translating complex scientific concepts into safe, ethical, and effective yoga practices without overstepping professional boundaries or making unsubstantiated claims. Careful judgment is required to ensure that the yoga teacher's guidance is supportive and complementary to a student's well-being, rather than a substitute for professional medical or psychological treatment. The correct approach represents best professional practice because it acknowledges the interconnectedness of mind and body, utilizing an understanding of neurotransmitters to inform gentle, supportive yoga interventions. This approach aligns with the ethical guidelines of a registered yoga teacher, RYT, with a therapeutic focus, which emphasizes a holistic understanding of well-being and the potential of yoga to positively influence physiological and psychological states. It respects the scope of practice by focusing on how yoga may influence neurotransmitter activity and, consequently, mood and behavior, rather than claiming to directly manipulate or treat specific conditions. This is consistent with a therapeutic focus that aims to support overall health and resilience. An incorrect approach that focuses solely on prescribing specific yoga poses to boost serotonin levels without considering individual student needs or contraindications would be ethically problematic. This fails to acknowledge the complexity of neurotransmitter systems and the potential for unintended consequences. It also risks overstepping the scope of practice by implying a direct, causal, and controllable link between a specific yoga practice and a specific neurotransmitter outcome, which could be misleading and potentially harmful if a student relies on this for managing a serious mood disorder. Another incorrect approach that dismisses the role of neurotransmitters entirely in the context of therapeutic yoga would be professionally limiting. While a yoga teacher is not a neuroscientist, ignoring the growing body of research on the mind-body connection and the neurobiological effects of practices like yoga would hinder the ability to offer truly informed and potentially beneficial therapeutic guidance. This approach fails to leverage a valuable area of knowledge that can enhance the therapeutic application of yoga. A further incorrect approach that involves diagnosing or treating mental health conditions based on perceived neurotransmitter imbalances would be a severe ethical and regulatory violation. This directly encroaches upon the domain of licensed medical and mental health professionals and could lead to significant harm to students. The professional decision-making process for similar situations should involve a continuous commitment to learning and professional development within the scope of yoga therapy. This includes staying informed about relevant research in neuroscience and psychology, but always interpreting this information through the lens of yoga practice and ethical guidelines. When considering the impact of yoga on mood and behavior, a therapist should focus on general principles of well-being, stress reduction, and the cultivation of mindful awareness, rather than making specific claims about neurotransmitter manipulation or disease treatment. Collaboration with other healthcare professionals is also a key component of best practice when working with individuals with complex health needs. Question 11. Governance review demonstrates that a registered yoga teacher RYT with a therapeutic focus is working with a client who, during a session, begins to exhibit noticeable shortness of breath, wheezing, and a pale complexion. The RYT recognizes these as significant indicators of respiratory distress. Considering the RYT's scope of practice and ethical obligations, what is the most appropriate immediate course of action? Option A. Recommend that the client discontinue the yoga session and schedule an appointment with a yoga therapist specializing in respiratory conditions at a later date. Option B. Encourage the client to focus on their breath and trust their body's innate ability to regulate itself, assuring them that yoga can help overcome such challenges. Option C. Suggest the client try a series of deep diaphragmatic breathing exercises and gentle restorative poses to help them relax and manage their breathing. Option D. Immediately advise the client to seek urgent medical attention from a physician or emergency services, while remaining with them to provide comfort and support until medical help arrives or they are safely on their way. The correct answer is D. Immediately advise the client to seek urgent medical attention from a physician or emergency services, while remaining with them to provide comfort and support until medical help arrives or they are safely on their way. Explanation. Scenario analysis. This scenario presents a professional challenge for a registered yoga teacher, RYT, with a therapeutic focus when encountering a client experiencing significant respiratory distress. The challenge lies in balancing the desire to provide therapeutic support with the absolute necessity of adhering to professional boundaries and regulatory guidelines concerning scope of practice. Misjudging the severity of the condition or overstepping professional boundaries can lead to harm to the client and professional repercussions for the teacher. Careful judgment is required to assess the client's immediate needs and determine the most appropriate and safe course of action within the RYT's defined scope. Correct approach analysis. The correct approach, which prioritizes immediate referral to a qualified medical professional, represents best professional practice because it aligns directly with the ethical and regulatory framework governing RYT certification. The Yoga Alliance RYT standards, which are foundational for this exam, emphasize that RYTs are not medical practitioners and should not diagnose, treat, or prescribe for medical conditions. Respiratory distress, especially when severe, falls squarely within the domain of medical care. Referring the client to a physician or emergency services ensures the client receives appropriate medical evaluation and treatment, thereby upholding the RYT's responsibility to do no harm and operate within their defined scope of practice. This proactive referral mitigates risk and demonstrates a commitment to client well-being above all else. Incorrect approach is analysis. An incorrect approach that involves attempting to manage the respiratory distress through advanced pranayama techniques without medical assessment is a significant regulatory and ethical failure. This directly violates the RYT's scope of practice by attempting to provide therapeutic intervention for a potentially serious medical condition without the necessary qualifications or authorization. It constitutes practicing outside of one's expertise and could exacerbate the client's condition, leading to harm. This action disregards the fundamental principle of client safety and the regulatory requirement to refer to medical professionals when conditions exceed the RYT's scope. Another incorrect approach, which is to offer general relaxation techniques and encourage the client to breathe through it while continuing the yoga session, is also professionally unacceptable. While relaxation is a component of yoga, it is insufficient and potentially dangerous when a client is experiencing acute respiratory distress. This approach fails to recognize the severity of the symptoms and neglects the RYT's ethical obligation to assess and respond appropriately to client distress. It demonstrates a lack of understanding of the potential underlying medical causes and a failure to prioritize immediate safety, thereby breaching professional duty of care and regulatory expectations. A third incorrect approach, which is to suggest the client consult a different yoga teacher who specializes in respiratory issues, is also a failure. While specialization is important, the immediate need is medical attention. Deferring the responsibility to another yoga teacher without ensuring the client has received or is seeking appropriate medical care is a dereliction of duty. The RYT has a responsibility to address the immediate crisis, which in this case is the respiratory distress, and that begins with medical referral, not further yoga-based consultation. This approach avoids the critical first step of ensuring medical safety. Professional reasoning. Professionals in therapeutic yoga must employ a decision-making framework that prioritizes client safety and adheres strictly to their scope of practice. This framework involves 1. Immediate assessment of the client's presentation for signs of distress that exceed the RYT's expertise. 2. Recognizing the limitations of yoga practice in addressing acute medical conditions. 3. Prioritizing referral to appropriate medical professionals for diagnosis and treatment when such conditions are suspected or evident. 4. Maintaining clear communication with the client about the referral and the RYT's role. 5. Documenting the situation and the actions taken. This systematic approach ensures that the RYT acts ethically, legally, and in the best interest of the client's health and well-being. Question 12. Strategic planning requires a registered yoga teacher, RYT, with a therapeutic focus to consider a client's diagnosed knee osteoarthritis, which approach best integrates anatomical and physiological understanding to ensure client safety and efficacy. Option A. Recommend a series of gentle stretching and strengthening exercises for the knee based on general anatomical principles of joint support, and advise the client to listen to their body and stop if they feel pain. Option B. Provide a list of yoga poses that are commonly recommended for knee pain, citing popular yoga literature, and instruct the client to perform them as they see fit, emphasizing the general benefits of yoga for joint health. Option C. Design a yoga sequence that includes poses known to strengthen quadriceps and hamstrings, assuming these muscles will support the knee joint, without further investigation into the client's specific range of motion or pain triggers. Option D. Consult with the client's orthopedic physician to understand the specific stage of osteoarthritis, any joint effusion, and recommended movement restrictions. Then collaboratively develop a yoga practice plan that complements medical advice and addresses the client's unique anatomical and physiological presentation. The correct answer is C. Design a yoga sequence that includes poses known to strengthen quadriceps and hamstrings, assuming these muscles will support the knee joint, without further investigation into the client's specific range of motion or pain triggers. Explanation: this scenario is professionally challenging because it requires a yoga teacher with a therapeutic focus to integrate anatomical and physiological knowledge into their practice, while adhering to professional standards and client safety. The challenge lies in accurately assessing a client's condition, understanding the contraindications and precautions related to their specific anatomy and physiology, and then designing a safe and effective yoga practice. Misinterpreting anatomical or physiological information can lead to ineffective recommendations or, worse, exacerbate a client's condition, leading to potential harm and professional liability. The correct approach represents best professional practice because it prioritizes a thorough understanding of the client's specific anatomical and physiological limitations before designing any therapeutic yoga intervention. This aligns with the ethical imperative to do no harm and the professional responsibility to provide evidence-informed guidance. By consulting with the client's healthcare provider, the yoga teacher ensures that their recommendations are complementary to existing medical treatment and are based on accurate, up-to-date information about the client's condition. This collaborative approach minimizes risk and maximizes the potential for positive outcomes, demonstrating a commitment to client well-being and professional integrity. An incorrect approach that involves proceeding with a general therapeutic yoga sequence without understanding the specific anatomical and physiological implications of the client's diagnosed condition is a significant regulatory and ethical failure. This demonstrates a lack of due diligence and a disregard for client safety. It could be considered negligence if harm results. Another incorrect approach, such as relying solely on anecdotal evidence or popular yoga trends without a foundational understanding of the client's specific anatomy and physiology, also fails to meet professional standards. This approach lacks the scientific rigor required for therapeutic work and could lead to inappropriate or harmful recommendations. Furthermore, failing to obtain informed consent regarding the limitations of yoga therapy and the need for medical consultation is an ethical breach and potentially a regulatory violation, as it misrepresents the scope of practice and the teacher's qualifications. Professionals should employ a decision-making process that begins with a comprehensive client assessment, including understanding their medical history and current physical status. This should be followed by a thorough review of relevant anatomical and physiological principles pertaining to their condition. Consultation with healthcare providers is crucial when dealing with therapeutic applications. The yoga teacher must then synthesize this information to design a personalized and safe yoga practice, clearly communicating any limitations and contraindications to the client. Continuous professional development in anatomy, physiology, and relevant therapeutic modalities is also essential for maintaining best practice. Question 13. Risk assessment procedures indicate that a registered yoga teacher with a therapeutic focus is working with a client experiencing chronic back pain and anxiety. The teacher is considering how to apply the 8 limbs of yoga to support the client's well-being. Which approach best demonstrates a responsible and therapeutically informed integration of the 8 limbs? Option A. Suggesting a broad range of asana and pranayama practices without a thorough assessment of the client's specific pain triggers, limitations, or contraindications, and without considering how other limbs might support or hinder the effectiveness of these practices. Option B. Prioritizing the application of asana, posture, and pranayama, breath control, to directly address physical discomfort and nervous system regulation, while also considering how yamas, ethical restraints, and niyamas, observances, can foster a supportive mindset and self-care practices relevant to the client's condition. Option C. Recommending advanced meditation techniques from dhyana meditation and samadhi, absorption, as the primary intervention, assuming that spiritual insight alone will resolve the client's physical and emotional distress. Option D. Focusing exclusively on the philosophical aspects of the 8 limbs, such as Santosha, contentment, and Ishvara pranidhana, surrender, to encourage the client to accept their pain and anxiety without actively seeking physical or physiological interventions. The correct answer is B. Prioritizing the application of asana posture and pranayama breath control to directly address physical discomfort and nervous system regulation, while also considering how yamas ethical restraints and niyamas observances can foster a supportive mindset and self-care practices relevant to the client's condition. Explanation. This scenario presents a professional challenge because the yoga teacher must integrate the therapeutic application of the 8 limbs of yoga into practice while adhering to the ethical and professional standards expected of a registered yoga teacher, RYT, with a therapeutic focus. The challenge lies in balancing the holistic philosophy of yoga with the practical, evidence-informed considerations necessary for therapeutic work, ensuring client safety and efficacy without overstepping professional boundaries or making unsubstantiated claims. Careful judgment is required to discern when a particular limb's application is appropriate and beneficial for a client's therapeutic goals, and when it might be contraindicated or require referral. The correct approach represents best professional practice because it prioritizes a client-centered, evidence-informed, and ethically grounded application of yoga principles. By focusing on the client's specific needs and contraindications, and by understanding the limitations of yoga therapy within its scope, the teacher demonstrates a commitment to client well-being and professional integrity. This aligns with the RYT credential's emphasis on responsible teaching and the therapeutic focus's requirement for a deeper understanding of how yoga can support health outcomes, while respecting the boundaries of the profession and the need for interdisciplinary collaboration when necessary. An incorrect approach that relies solely on a generalized, philosophical interpretation of the 8 limbs, without considering the individual client's therapeutic context, is professionally unacceptable. This could lead to inappropriate recommendations that may not be beneficial or could even be harmful, violating the ethical principle of do no harm. Furthermore, making therapeutic claims or offering interventions that fall outside the scope of yoga therapy without appropriate qualifications or referral constitutes a regulatory and ethical failure. Another incorrect approach might involve neglecting the foundational ethical principles, yamas and niyamas, in the application of other limbs, such as a lack of non-harming ahimsa, in recommending intense practices without proper assessment, or a failure in self-study, svadhyaya, to understand the client's condition adequately. This demonstrates a lack of professional responsibility and a disregard for the client's safety and progress. The professional decision-making process for similar situations should involve a thorough client intake and ongoing assessment, a deep understanding of the client's health status and therapeutic goals, and a nuanced application of yoga principles informed by both yogic philosophy and relevant therapeutic knowledge. Professionals should continuously engage in self-reflection and professional development, understanding the scope of their practice and when to seek consultation or refer clients to other healthcare professionals. This iterative process ensures that the application of yoga is always safe, ethical, and aligned with the client's best interests. Question 14. Market research demonstrates a growing interest in yoga for managing stress and anxiety. A client diagnosed with a generalized anxiety disorder by their physician approaches you, a registered yoga teacher RYT, with a therapeutic focus, seeking specific yoga practices to cure their anxiety. Considering the regulatory framework for RYTs with a therapeutic focus, what is the most appropriate course of action? Option A. Suggests that the client discontinue their medical treatment and rely solely on a comprehensive yoga program you will develop, as yoga has proven effective in many cases. Option B. Advise the client that, while yoga can be a supportive practice for stress management, their diagnosed anxiety disorder requires professional medical treatment, and recommend they continue working with their physician and discuss any new practices with them. Option C. Immediately design a personalized yoga sequence incorporating specific pranayama techniques and asanas believed to directly alleviate anxiety symptoms, assuring the client that yoga is a powerful natural remedy. Option D. Provide general relaxation techniques and breathing exercises, downplaying the significance of their diagnosed anxiety disorder and focusing only on broad stress reduction. Correct answer is B. Advise the client that while yoga can be a supportive practice for stress management, their diagnosed anxiety disorder requires professional medical treatment, and recommend they continue working with their physician and discuss any new practices with them. Explanation. This scenario presents a professional challenge because a registered yoga teacher, RYT, with a therapeutic focus is asked to provide guidance that borders on medical advice without proper qualification. The core of the challenge lies in distinguishing between general stress management techniques, which are within the RYT scope, and specific therapeutic interventions for a diagnosed condition, which are not. Careful judgment is required to ensure client safety and adhere to professional boundaries. The correct approach represents best professional practice because it prioritizes client well-being and operates within the defined scope of practice for an RYT. By recommending consultation with a qualified healthcare professional for a diagnosed condition, the RYT is acting ethically and responsibly. This aligns with the implicit understanding that therapeutic yoga is complementary and not a substitute for medical treatment. The regulatory framework for RYTs, while not explicitly detailing every medical scenario, emphasizes the importance of not practicing outside one's expertise and of referring clients to appropriate professionals when their needs exceed the RYT's training. This upholds the integrity of the profession and protects the public. An incorrect approach that involves suggesting specific yoga poses or breathing techniques as a direct treatment for a diagnosed anxiety disorder without a medical referral would be a significant regulatory and ethical failure. This constitutes practicing outside the scope of an RYT's training, potentially leading to harm if the techniques are inappropriate for the individual's specific condition, or if they delay necessary medical intervention. It violates the ethical principle of do no harm and the regulatory expectation that practitioners operate within their defined competencies. Another incorrect approach, such as dismissing the client's concerns or providing generic stress relief advice without acknowledging the diagnosed condition, is also ethically problematic. While not as directly harmful as prescribing treatment, it fails to adequately address the client's stated needs and demonstrates a lack of professional empathy and understanding of the therapeutic context. It also misses an opportunity to guide the client toward appropriate care. The professional decision-making process for similar situations should involve a clear understanding of one's scope of practice as an RYT. When a client presents with a diagnosed medical or mental health condition, the first step is to acknowledge their situation with empathy. The next crucial step is to assess whether the client's needs fall within the RYT's expertise. If the client is seeking guidance directly related to managing their diagnosed condition, the professional decision should be to refer them to their healthcare provider or a specialist. The RYT can then offer complementary support through general stress reduction techniques that are within their scope, provided these are not presented as a cure or direct treatment for the diagnosed condition. This layered approach ensures client safety, ethical practice, and adherence to regulatory guidelines. Question 15. Stakeholder feedback indicates a desire for more specialized therapeutic yoga sequences to address common conditions like chronic lower back pain and osteoarthritis. As an RYT with a therapeutic focus, what is the most appropriate and ethically compliant course of action when a client expresses a strong preference for a specific sequence they found online, claiming it will cure their condition? Option A. Recommend the client consult with their primary healthcare provider to discuss the proposed sequence and ensure it aligns with their medical treatment plan, while offering to collaborate with the provider if they deem it appropriate. Option B. Advise the client that as an RYT, you cannot provide medical advice and suggest they seek guidance from a qualified medical professional for their condition, without offering any yoga-related support. Option C. Design a modified version of the online sequence based on general knowledge of yoga for pain management, assuming it will be beneficial as long as it feels good to the client. Option D. Implement the online sequence as requested by the client, as their expressed desire for a specific intervention should be respected and fulfilled to ensure client satisfaction. The correct answer is A. Recommend the client consult with their primary healthcare provider to discuss the proposed sequence and ensure it aligns with their medical treatment plan, while offering to collaborate with the provider if they deem it appropriate. Explanation. This scenario is professionally challenging because it requires a registered yoga teacher, RYT, with a therapeutic focus to navigate the delicate balance between providing beneficial yoga practices and operating within the scope of their professional training and ethical guidelines. The RYT must ensure that their recommendations for therapeutic sequences are evidence-informed, safe, and do not overstep into the realm of medical diagnosis or treatment, which is reserved for licensed healthcare professionals. The core challenge lies in interpreting stakeholder feedback, which may express a desire for specific outcomes, and translating that into appropriate, safe, and ethically sound yoga interventions. The correct approach represents best professional practice because it prioritizes client safety, professional integrity, and adherence to the established scope of practice for an RYT. By consulting with the client's healthcare provider, the RYT ensures that the proposed therapeutic yoga sequence is complementary to the client's existing medical care and is appropriate for their specific condition. This collaborative approach aligns with ethical guidelines that emphasize interdisciplinary cooperation and the importance of not providing services beyond one's competence or licensure. It also demonstrates a commitment to evidence-based practice by seeking professional input on the efficacy and safety of the proposed interventions for a specific medical condition. An incorrect approach that involves designing a therapeutic sequence solely based on general online research or personal experience, without consulting healthcare professionals, presents significant regulatory and ethical failures. This approach risks providing inappropriate or even harmful recommendations, potentially exacerbating the client's condition or interfering with their prescribed medical treatment. It violates the ethical principle of do no harm and demonstrates a lack of due diligence in understanding the client's specific medical context. Furthermore, it could be construed as practicing outside the scope of an RYT's training, bordering on providing medical advice, which is a violation of professional boundaries and potentially legal regulations. Another incorrect approach, which is to dismiss the stakeholder feedback entirely due to a lack of specific training in that condition, while prioritizing safety, fails to leverage the RYT's therapeutic focus. While caution is paramount, an RYT with a therapeutic focus is expected to have a foundational understanding of common conditions and how yoga can be supportive. Completely disengaging without exploring potential safe avenues or seeking appropriate consultation misses an opportunity to provide valuable support within their scope. This can lead to a perception of unresponsiveness and a failure to fully utilize their specialized training. The professional decision-making process for similar situations should involve a multi-step approach. 1. Acknowledge and validate stakeholder feedback. 2. Assess the feedback against the RYT's scope of practice and training. 3. If the feedback pertains to a specific medical condition, prioritize client safety by recommending consultation with their primary healthcare provider. 4. If appropriate and within scope, research evidence-informed yoga practices for the condition, always cross-referencing with reputable sources and professional yoga therapy guidelines. 5. Collaborate with the client and their healthcare provider to develop a safe and supportive yoga sequence. 6. Continuously monitor the client's response and adjust the practice as needed, always in communication with the client and their medical team. 7. Maintain clear boundaries and avoid making medical diagnoses or offering treatment plans. Question 16. Cost-benefit analysis shows that while yoga can offer supportive benefits for stress management, a client presents with a constellation of symptoms including fatigue, mood swings, and irregular sleep patterns, which could indicate an endocrine system imbalance. What is the most appropriate initial course of action for a registered yoga teacher with a therapeutic focus? Option A. Recommend the client consult with a medical doctor or endocrinologist for a proper diagnosis and treatment plan before proceeding with any specialized yoga interventions. Option B. Advise the client that these symptoms are common and can be managed through general stress reduction techniques offered in standard yoga classes. Option C. Immediately design and implement a yoga sequence specifically targeting the endocrine system, aiming to rebalance hormones through breathwork and asana. Option D. Suggest the client try a series of vigorous yoga practices to boost metabolism and energy levels, which may indirectly address hormonal fluctuations. The correct answer is A. Recommend the client consult with a medical doctor or endocrinologist for a proper diagnosis and treatment plan before proceeding with any specialized yoga interventions. Explanation. This scenario presents a professional challenge because it requires a registered yoga teacher, RYT, with a therapeutic focus to navigate the complex interplay between yoga practice and the endocrine system, specifically in relation to a client experiencing symptoms suggestive of hormonal imbalance. The RYT must balance the potential benefits of yoga with the need to avoid overstepping professional boundaries and potentially exacerbating a medical condition. The core challenge lies in recognizing the limits of yoga therapy and the necessity of appropriate medical referral. The correct approach represents best professional practice because it prioritizes client safety and well-being. By acknowledging the limitations of yoga therapy in diagnosing or treating endocrine disorders, this approach aligns with the ethical guidelines for RYTs, which emphasize scope of practice and the importance of collaborating with healthcare professionals. By recommending a medical consultation, the RYT ensures the client receives appropriate medical evaluation and treatment for their symptoms, while still offering supportive yoga practices that can be integrated into a broader healthcare plan, provided they are cleared by a physician. This demonstrates responsible practice and adherence to professional standards that protect both the client and the practitioner. An incorrect approach that involves immediately prescribing a specific yoga sequence designed to balance hormones without a medical diagnosis fails to recognize the potential risks. This could lead to the client delaying or foregoing necessary medical intervention, potentially worsening their condition. Ethically, it constitutes practicing outside the RYT scope of practice, as diagnosing and treating medical conditions falls under the purview of licensed healthcare providers. Another incorrect approach, such as dismissing the client's symptoms as unrelated to any medical issue and continuing with a standard yoga class, is also professionally negligent. It fails to acknowledge the client's subjective experience and the potential for underlying health concerns, thereby not acting in the client's best interest. Professional decision-making in such situations requires a systematic approach. 1. Active listening and observation. Pay close attention to the client's reported symptoms and any observable physical or emotional cues. 2. Scope of practice assessment. Determine if the client's concerns fall within the RYT's training and expertise. 3. Risk identification. Evaluate the potential risks of intervening without medical consultation. 4. Referral protocol. Initiate a clear and supportive referral to a qualified healthcare professional when symptoms suggest a medical condition. 5. Collaborative support. Offer to work in conjunction with the client's medical team, with their consent, to provide appropriate yoga support. Question 17. Quality control measures reveal that a registered yoga teacher, RYT, with a therapeutic focus is working with a client who has a history of asthma. The client requests a modification to a specific pranayama technique, stating it feels constricting. The RYT needs to determine the safest and most effective way to address this request, considering the anatomy of the respiratory system. Which of the following approaches best demonstrates professional best practice? Option A. The RYT suggests a generic breathing exercise that is commonly used for relaxation, without specifically considering the client's asthma or the anatomical implications of the original pranayama technique. Option B. The RYT dismisses the client's request, stating that all pranayama techniques are standardized and should not be altered, regardless of individual conditions. Option C. The RYT explains the anatomical structures involved in the pranayama technique, such as the diaphragm and intercostal muscles, and how the requested modification might affect airflow and lung volume, then collaboratively proposes an alternative breath pattern that respects the client's respiratory anatomy and comfort. Option D. The RYT immediately implements the client's requested modification without further inquiry, assuming the client knows what feels best for their body. The correct answer is C. The RYT explains the anatomical structures involved in the pranayama technique, such as the diaphragm and intercostal muscles, and how the requested modification might affect airflow and lung volume, then collaboratively proposes an alternative breath pattern that respects the client's respiratory anatomy and comfort. Explanation. Scenario analysis. A registered yoga teacher, RYT, with a therapeutic focus is asked by a client with a history of asthma to modify a breathing exercise. The challenge lies in balancing the client's request with the RYT scope of practice and understanding of respiratory anatomy and potential contraindications. Misinterpreting the client's needs or the physiological implications of the requested modification could lead to adverse health outcomes, highlighting the critical need for accurate anatomical knowledge and ethical practice. Correct approach analysis. The best professional practice involves a thorough understanding of the respiratory system's anatomy and physiology, specifically how different breathing techniques impact airflow, lung capacity, and potential triggers for respiratory distress in individuals with conditions like asthma. This includes recognizing that certain pranayama techniques might exacerbate symptoms or be contraindicated. The RYT should assess the client's current state, understand the specific nature of their asthma, and then, based on their anatomical knowledge, propose modifications that are safe and beneficial, or explain why a particular technique might be risky. This aligns with the ethical imperative to do no harm and to practice within the RYT's defined scope, which includes understanding the body systems to inform safe practice. Incorrect approach is analysis. One incorrect approach would be to blindly follow the client's request without considering the anatomical and physiological implications. This fails to uphold the RYT's responsibility to ensure client safety, potentially violating ethical guidelines that require practitioners to act with competence and to avoid causing harm. It demonstrates a lack of understanding of how specific breathing patterns interact with the respiratory system, especially in a compromised state. Another incorrect approach would be to refuse the modification outright without explanation or offering alternatives. Caution is necessary. A complete refusal without engaging with the client's needs or explaining the anatomical reasoning behind the caution can be perceived as unsupportive and lacking in therapeutic empathy. It fails to leverage the RYT's knowledge to find a safe and effective solution, potentially hindering the client's therapeutic progress. A third incorrect approach would be to offer a modification based on anecdotal evidence or general yoga principles without specific consideration for the client's respiratory anatomy and asthma. This demonstrates a superficial understanding of therapeutic yoga and a failure to apply specific anatomical knowledge to individual client needs, which is a cornerstone of a therapeutic focus. It risks implementing a technique that, while seemingly benign, could still have unintended negative consequences on the respiratory system. Professional reasoning. Professionals in therapeutic yoga must integrate their understanding of anatomy and physiology with client-centered care. The decision-making process should involve 1. Active listening to the client's requests and concerns. 2. Assessing the client's condition and any relevant medical history. 3. Applying knowledge of relevant anatomy and physiology to evaluate the safety and efficacy of the requested modification. 4. Communicating clearly with the client about the rationale behind any proposed changes or limitations. 5. Collaborating with the client to find the most beneficial and safe approach, potentially recommending consultation with a healthcare provider if the situation falls outside the RYT's scope of expertise. Question 18. Stakeholder feedback indicates that a long-term client who has been attending therapeutic yoga sessions for a chronic pain condition expresses feeling much better and more in control of their pain, but their objective measures of range of motion and pain intensity scores have shown only marginal improvement over the past 3 months. As the RYT with a therapeutic focus, how should you proceed with assessing and documenting this client's progress? Option A. Share the client's subjective feedback about feeling much better with their referring physician without obtaining explicit consent, explaining that while objective measures are slow, the client feels a significant improvement. Option B. Prioritize the client's subjective report of feeling much better and more in control, updating their progress notes to reflect significant improvement and adjusting the therapeutic plan to maintain the current approach. Without further objective verification, Option C. Integrate the client's subjective report of feeling much better and more in control with the objective data on range of motion and pain scores, noting the discrepancy and discussing with the client how their perception of control might be contributing to their overall well-being, despite limited objective changes. Option D. Focus solely on the objective measures of range of motion and pain intensity scores, documenting the marginal improvement and recommending a change in the therapeutic plan based on these quantitative findings, while downplaying the client's subjective report. The correct answer is C. Integrate the client's subjective report of feeling much better and more in control with the objective data on range of motion and pain scores, noting the discrepancy and discussing with the client how their perception of control might be contributing to their overall well-being, despite limited objective changes. Explanation. This scenario presents a professional challenge because it requires balancing the client's subjective perception of progress with objective assessment data, while adhering to ethical guidelines for therapeutic yoga practice. The registered yoga teacher, RYT, with a therapeutic focus must navigate potential biases, ensure client autonomy, and maintain professional integrity in documenting and communicating progress. Careful judgment is needed to avoid over-reliance on anecdotal evidence or imposing a personal definition of progress that may not align with the client's goals or therapeutic needs. The correct approach represents best professional practice because it prioritizes a holistic and collaborative assessment process. By integrating subjective client feedback with objective observations and standardized assessment tools, the RYT can create a comprehensive picture of the client's progress. This approach aligns with ethical principles of client-centered care, informed consent, and professional accountability. It ensures that progress tracking is not only accurate but also meaningful to the client, fostering trust and adherence to the therapeutic plan. Furthermore, maintaining detailed, objective records supports professional development and provides a basis for evidence-informed practice, which is crucial in a therapeutic context. An incorrect approach that relies solely on the client's subjective report without objective verification fails to uphold professional standards. It risks misinterpreting the client's experience, potentially leading to inappropriate adjustments in the therapeutic plan or an inaccurate assessment of efficacy. This could be seen as a failure to exercise due diligence and professional judgment, potentially impacting client safety and outcomes. Another incorrect approach that dismisses the client's subjective experience in favor of purely quantitative data overlooks the crucial mind-body connection inherent in therapeutic yoga. Progress in a therapeutic context is not solely about measurable physical changes, but also encompasses emotional well-being, self-awareness, and perceived quality of life. Ignoring the client's voice can lead to a disconnect between the practitioner's assessment and the client's lived experience, undermining the therapeutic alliance. A third incorrect approach that involves sharing subjective client feedback with other stakeholders without explicit, informed consent violates client confidentiality and privacy. This is a significant ethical and potentially legal breach, eroding trust and professional boundaries. Therapeutic relationships are built on a foundation of confidentiality, and any deviation from this principle is unacceptable. The professional decision-making process for similar situations should involve a systematic approach. 1. Clearly define the client's therapeutic goals in collaboration with the client. 2. Select and utilize appropriate assessment tools, both subjective and objective, that are relevant to the client's goals and the therapeutic focus. 3. Regularly collect and analyze data from these assessments, looking for patterns and trends. 4. Engage in open and honest communication with the client about their perceived progress and the assessment findings. 5. Document all assessments and communications thoroughly and objectively. 6. Continuously evaluate and adapt the therapeutic plan based on the integrated assessment data and client feedback. 7. Maintain strict adherence to confidentiality and professional boundaries at all times. Question 19. Compliance review shows a registered yoga teacher, RYT, with a therapeutic focus is preparing to lead a class for seniors. The teacher has identified that many participants may have reduced mobility, balance challenges, and potential joint discomfort. What is the most appropriate approach to modifying poses for this group? Option A. Assume that all seniors can safely perform basic poses with minimal modifications, as yoga is inherently gentle and beneficial for all ages. Option B. Conduct an individual risk assessment for each participant, gathering information on their specific health conditions, limitations, and comfort levels, and then tailor modifications accordingly. Option C. Implement a standardized set of modifications for all poses that are generally considered safer for older adults, such as using chairs for support and avoiding deep twists. Option D. Rely on the participants' self-reporting during the class to indicate when they need a modification, intervening only when a pose appears visibly difficult. The correct answer is C. Implement a standardized set of modifications for all poses that are generally considered safer for older adults, such as using chairs for support and avoiding deep twists. Explanation. This scenario presents a common challenge in therapeutic yoga, adapting practices for a vulnerable population with specific physiological considerations. Seniors often experience age-related changes such as decreased bone density, reduced joint mobility, and potential cardiovascular or balance issues. A therapeutic yoga teacher must conduct a thorough risk assessment to ensure the safety and efficacy of their modifications. The challenge lies in balancing the benefits of yoga with the potential risks, requiring a nuanced understanding of both yoga principles and geriatric physiology. The correct approach prioritizes a comprehensive, individualized risk assessment. This involves gathering detailed information about each senior's health status, including any pre-existing conditions, medications, and previous injuries. Based on this information, the teacher can then implement specific, evidence-informed modifications that address potential limitations, while still allowing the individual to experience the therapeutic benefits of the practice. This aligns with the ethical imperative to do no harm and the professional standard of care expected of a therapeutic yoga teacher. It also reflects the regulatory expectation that practitioners operate within their scope of practice and prioritize client safety. An incorrect approach would be to apply a one-size-fits-all modification strategy. This fails to acknowledge the unique needs and limitations of each individual, potentially exposing some seniors to undue risk. For example, assuming all seniors can safely perform a seated forward fold without assessing their spinal health or hamstring flexibility could lead to back strain or injury. Similarly, assuming all seniors can safely stand for balance poses without considering their history of falls or dizziness is a significant oversight. These approaches demonstrate a lack of due diligence in the risk assessment process and a failure to adhere to the principle of individualized care, which is a cornerstone of therapeutic practice and a likely regulatory expectation for qualified practitioners. Professionals should approach such situations by first establishing clear communication channels with their clients to gather comprehensive health information. This should be followed by a systematic risk assessment process that identifies potential hazards and develops appropriate mitigation strategies through modifications. Continuous observation and feedback during the practice are crucial for making real-time adjustments. When in doubt, consulting with healthcare professionals or referring clients to them is an essential part of responsible practice and ensures that the yoga teacher is operating within their expertise and scope. Question 20. Assessment of a registered yoga teacher's RYT response when a new client seeking a therapeutic yoga focus states they have been experiencing persistent back pain for several weeks and believe it is due to a pinched nerve and asks for a yoga program to fix it. Option A. Tell the client that yoga is not suitable for treating nerve-related pain and recommend they seek alternative therapies. Option B. Advise the client that while yoga can be beneficial for back pain, it is crucial to first consult with a medical doctor or physical therapist to receive a proper diagnosis and treatment plan for their specific condition before beginning any therapeutic yoga program. Option C. Immediately design a series of yoga poses and stretches specifically targeting the lumbar spine, assuring the client that yoga is a powerful natural remedy for nerve compression. Option D. Suggest the client try over-the-counter pain relievers and rest for a few days, and if the pain persists, then consider yoga as a secondary option. The correct answer is B. Advise the client that while yoga can be beneficial for back pain, it is crucial to first consult with a medical doctor or physical therapist to receive a proper diagnosis and treatment plan for their specific condition before beginning any therapeutic yoga program. Explanation. Scenario analysis. This scenario presents a common challenge for therapeutic yoga teachers, navigating the ethical and professional boundaries when a client expresses a desire to use yoga for a condition that may require medical intervention. The challenge lies in balancing the client's autonomy and their belief in yoga's efficacy with the teacher's responsibility to avoid practicing outside their scope of competence and to ensure client safety. The teacher must recognize the limitations of yoga therapy and the potential risks of delaying or replacing conventional medical care. Correct approach analysis. The correct approach demonstrates adherence to professional ethical guidelines and scope of practice for registered yoga teacher RYT with a therapeutic focus. It prioritizes client well-being by acknowledging the client's stated goal while responsibly guiding them towards appropriate medical assessment. This aligns with the ethical imperative to do no harm and to practice within one's expertise. Referring the client to a qualified healthcare professional for diagnosis and treatment of their specific condition is paramount. This ensures the client receives appropriate medical care, and the yoga teacher can then collaborate with the healthcare team, if appropriate, to integrate yoga as a complementary therapy, respecting the established medical diagnosis and treatment plan. This approach upholds the RYT's role as a facilitator of well-being, not a medical diagnostician or sole practitioner for serious conditions. Incorrect approaches analysis. One incorrect approach involves directly recommending specific yoga poses or sequences to address the client's self-diagnosed condition without a medical evaluation. This constitutes practicing outside the scope of a yoga teacher's training and competence, potentially leading to harm if the yoga intervention is inappropriate for the underlying medical issue or if it delays necessary medical treatment. This violates the ethical principle of practicing within one's scope and the responsibility to ensure client safety. Another incorrect approach is to dismiss the client's concerns or their desire to use yoga, implying that yoga is not suitable for their situation. While caution is necessary, outright dismissal can alienate the client and prevent them from seeking appropriate help. It fails to acknowledge the client's agency and the potential complementary role yoga might play once a medical diagnosis is established. A third incorrect approach is to agree to provide yoga therapy for the condition without first ensuring the client has consulted a medical professional. This could be interpreted as implicitly endorsing the client's self-diagnosis and potentially offering yoga as a primary treatment, which is beyond the RYT scope and could have serious consequences for the client's health. Professional reasoning. When faced with a client expressing a desire to use yoga for a specific health concern, a therapeutic yoga teacher should employ a decision-making process that prioritizes client safety and ethical practice. This involves 1. Active listening and empathy. Acknowledge the client's concerns and their interest in yoga. 2. Scope of practice awareness. Clearly understand the boundaries of yoga teaching and therapy versus medical practice. 3. Referral and collaboration. Recognize when a condition requires medical expertise and facilitate appropriate referrals. 4. Informed consent and education. Educate the client about the role of yoga and its limitations in relation to their health condition. 5. Documentation. Maintain clear records of client interactions, including any referrals made. This systematic approach ensures that the teacher acts responsibly, ethically, and in the best interest of the client's overall well-being.